Congratulations, you're a new mom. And in a flash, everything has changed. And I don't just mean dealing with late night feedings, endless rounds of diaper changing, and the weighty responsibility of another life on your shoulders. I'm talking about your body. You may not be pregnant anymore, but it's not like it's magically returned to its pre-pregnancy state. But will it ever? How are you supposed to know what's normal and what's not? How long are these changes going to last? Is there anything you can do to speed up the process? And what's the one thing you should remember if you think you need to see the doctor? There's a lot of advice out there, and that's why I brought in a pro. My guest today is Dr. Erica Newlin, an obstetrician and gynecologist with the Cleveland Clinic, which means she's ready to give us the scoop on what to expect during your 4th trimester. I'm Tori, and this is the TMI Show. Thanks for your time, Dr. Newlin. Can you tell me a little bit about yourself?
I'm a general OBGYN at the Cleveland Clinic, meaning I take care of patients from adolescence to menopause, during pregnancy, or any GYN concern.
What are some of the most common postpartum changes to women's bodies? Which seem to be the most surprising to the new moms you care for?
The biggest surprise for people postpartum is that your bodies don't immediately bounce back, and that's okay. I think some people the day or two after delivery are like, man, I still look pregnant. Your uterus is still getting down to size. You feel a little different when you pee or use the bathroom.
Okay, what about incontinence and constipation? How long should that last? What remedies do you suggest to your patients?
Starting with incontinence. So a lot of people find that, particularly in the first couple weeks postpartum, that they're experiencing what we call stress incontinence, meaning that when you cough or sneeze or laugh or pick up something heavy, that you might leak a little bit of urine. And that can continue for the first 6 to 8 weeks. It's super common to have tears or lacerations in the vaginal area postpartum, and you can be really sore as you heal. So even if you don't have tears, it can burn while you pee, or you may have swelling in the vaginal area. You may have stitches in the vaginal area. I often tell patients, don't look down there because everything looks a little swollen. If you find that things aren't getting better after that 6 to 8 weeks, there's a popular exercise called Kegel exercises. That's tightening that muscle that stops the flow of urine when you're peeing. But there are also physical therapists that are specifically designated to the pelvic floor. And if your doctor thinks it's appropriate, they can send you a consultation to pelvic floor physical therapy, and they can work with you on strengthening those muscles postpartum. As far as constipation, it's usually worst in the first week after delivery. And there's a couple different aspects that can lead to constipation. One is if you're on any pain medications, particularly opioid pain medications, those can be constipating. And in general, you can be dehydrated or your bottom can feel very sore postpartum, leaving it harder to push out poop. So things like fiber supplements, stool softeners, and just drinking a ton of water can be really helpful.
Can you tell me a little bit about hair loss after pregnancy? Why does that happen? Is there anything women can do to prevent it?
During pregnancy, the increased estrogen actually keeps you from shedding the hair like we normally do. And then after delivery, that estrogen tends to go down. And with that, your body starts to catch up and you lose hair. Unfortunately, there's not much to do to prevent it, but I think just normal hair care, like trying to avoid really tight ponytails, trying to avoid really heavy conditioners, putting a lot of things on your hair can sometimes help keep your hair healthier.
Are there any signs that a new mom should watch out for in case it's time to see a professional?
Certainly, the big things that I tell people to watch out for is any fever or severe pain postpartum would be something I want to know about right away. So some cramping, particularly cramping with breastfeeding, can be common as the uterus goes down to size. But if you find that your stomach's very tender or you're having pain that's not relieved with Motrin or Tylenol, that would be something I'd want to know about. Bleeding, I tell patients that bleeding like a period or like a heavy period, normal. Saturating through pads or bleeding really heavy, not normal.
And how do you counsel patients who hope to get their weight and fitness back to pre-baby levels?
Like I said before, I think the first thing that I stress to everyone is that your body's gone through a lot of change during pregnancy, and that trying to get that pre-baby body back right away just isn't good for people's health and isn't good for people's mental health, for sure. So it can take a little time to feel more like yourself and get your energy back. I think staying active as much as you can by going on walks outside and staying active with your new baby is helpful for both physical health and mental health. Most patients will get the all clear from their doctor around 6 weeks postpartum to do whatever exercise they feel comfortable with. I tell a lot of my patients that it's normal to feel deconditioned or get out of breath a little easier postpartum, and that they may not be able to do the things that they used to be able to do immediately, and that it's okay to push yourself a little bit, but if something really hurts and is causing pain, that's probably your body telling yourself to back off.
Is there anything else you'd like to share?
Yeah, I think the biggest thing is just knowing that you're not going to bounce back right away, and that's okay. It's a big change. You're taking care of a new human. The postpartum period is a lot on your mental health and your physical health. I really like now that we're kind of calling it this fourth trimester, this kind of aspect after pregnancy where your body is just adjusting and you're adjusting to your new family. And if you feel uncomfortable about something or have questions, feel free to go to your doctor, because that's what we're here for. And honestly, no question is too embarrassing. Like, I went into women's health because I'm all about talking about vaginas and sex, and hopefully your gynecologist feels the same way.
Thanks so much for talking with us today. Do you have any TMI questions you want answered? Drop them in the comments, like and subscribe, and stay tuned for more TMI Show. Thanks for watching.